Psoriasis is a chronic autoimmune condition that causes areas of thickened, inflamed red skin, often covered with silvery scales. It is not an infection, nor it is contagious. Sit tight today because I will tell you everything you need to know about psoriasis. Welcome to another episode of Dr. Says. What causes psoriasis? Well, researchers have not yet identified the exact cause of psoriasis. However, it is believed it is due to a combination of immune, genetic, and environmental factors. The skin is made of several layers. The top layer is the epidermis, a layer of cells that divide and eventually die, covering the surface of the skin with a layer of dead cells called the stratum corneum. Every day, as cells in the epidermis die and became part of the stratum corneum, dead cells at the top of the stratum corneum are also shed. In skin affected by psoriasis, the epidermis grow very rapidly and stop shedding properly, causing scaly build-up composed of dead skin cells. Genetics does play a role in determining whether someone develops psoriasis. About 40% of people with psoriasis or psoriatic arthritis have family member with the disorder. As for environmental factors, certain environmental and behavior factors seem to be linked to psoriasis. Example includes stress, alcohol consumption, and certain medications, including beta blockers, lithium, and anti-malarial drugs. Smoking also appears to increase the risk and severity of psoriasis, particularly for psoriasis of the palms and soles. There are several common types of psoriasis, and the most common form of psoriasis is plaque psoriasis. Plaque psoriasis tends to affect young and middle-aged adults, but can occur at any age. Some of the most common areas for plaques are the scalps, elbows, knees, and back. The severity of plaque psoriasis varies widely. It can occur in just a few small areas or may cover a large portion of the body. The next psoriasis is guttate psoriasis. This type of psoriasis is sometimes linked to a recent streptococcal infection, usually pharyngitis. It often affects children or young adults with no past history of psoriasis and causes a sudden eruption of small scaly papules on the trunk of the body. A more severe and occasionally life-threatening psoriasis is known as pustular psoriasis. It develops quickly with multiple small pustules that may join into larger areas. Pustular psoriasis can also cause pus-filled blisters on the palms of the hand and soles of the feet. These blisters can crack, causing painful breaks in the skin and can be pretty disabling. Next, inverse psoriasis. This type of psoriasis affects less visible areas of the body, such as the groin, armpits, buttocks, genitals, and area under the breast. Sometimes this is mistakenly diagnosed as fungal infection. Next, nail psoriasis. Some people with psoriasis develop nail problems, including tiny pits over the surface of the nails. These pits looks as if someone has taken a pin and pricked the nail several times. In addition, nails may develop a tan-brown color known as oil spots or may separate from the nail bed known as onycholysis. In more severe cases, people have thick, crumbling nails. And lastly, psoriatic arthritis. Up to a third of people with psoriasis also have psoriatic arthritis, a condition that causes joint pain and swelling. Now, moving on to the treatment. It can be divided into topical or oral medications. For topical treatment, emollients can keep the skin moist and minimize itching and tenderness. Over-the-counter moisturizers such as petroleum jelly or thick creams may be recommended, and these should be applied immediately after bathing. Topical corticosteroids can be applied to the skin to help reduce the inflammation. This is often done twice a day at the beginning of the treatment. I've previously covered the types and strengths of corticosteroids on my video on eczema. Feel free to drop by, link will be in the top right corner. Topical vitamin D analogs known as calcipotriene or calcitriol can be used to treat psoriasis. They work by slowing the growth of the skin in the epidermis. As for oral medications, methotrexate treats psoriasis by suppressing the immune response that triggers the disease. This drug is often used to treat moderate to severe psoriasis. It is usually taken once a week and it may be taken in oral form or as an injection. Another oral medications recommended to treat severe form of psoriasis is retinoids. Retinoids are derived from vitamin A, and oral form is called acitretin. Improvement may be noticeable within 1 month, although the full effects of retinoids may take up to 3 to 6 months. Acitretin can cause severe birth defects. Therefore, this medication is typically not prescribed to women who could get pregnant. Another medication is known as injectable or known as biologics. Because of their cost and potential side effects, these are generally reserved for people with moderate to severe psoriasis that has not responded to other treatments. To your surprise, exposure to ultraviolet light is another way to treat psoriasis. During the summer months, people with psoriasis often notice that their symptoms improve, and this forms the basis of the treatment. Doctors use special ultraviolet lights known as UVA and UVB to treat psoriasis. However, long-term ultraviolet light therapy may increase the risk for skin cancer. Therefore, it is not recommended for people with history of melanoma or skin cancers. So there you have it, guys. This is all you need to know about psoriasis. But do you know, majority of the people are unable to differentiate between psoriasis and eczema, often mistaken one for the other? Click on the link to find out more about eczema.